So thank you so much for coming by, Doctor. Tell me, please, a little bit about you and your organization, what you do on a day-to-day and, overall basis.
Awesome. I am a family medicine physician. I am the founder and CEO of the Rowe Network. And I started this organization 3 years ago. I am a mom and I love medicine, but I wanted more flexibility in my schedule. So today, the Rowe Network helps physicians who want to do telemedicine find a way to practice on their terms. So we really empower doctors to provide the best care online.
Right, and when they can, at maybe hours that...
Oh, absolutely. So each doctor is their own boss. So they create their own schedule, their own hours. We basically provide the system to help them to do telemedicine and market on their behalf to their patients.
Okay, and tell me about telemedicine. Tell me about why telemedicine is so critical for doctors and for patients.
Oh my God. Every day I'm reaching out to doctors, talking to doctors, telling them how important it is to do telemedicine because we really need to meet patients at the point of their need. And so I have a child. I may not be able to take time off work to take my child to the doctor. And there are plenty of people in the same situation. There are people that are traveling, busy travelers, people who are homebound. And so if we really want to move forward and be healthier as a nation, we have to be innovative in delivering care. And it is our responsibility as physicians to provide care to people on those terms so that they can get healthier. You shouldn't have to choose between seeing a traditional doctor, waiting hours in a doctor's office, or being healthy.
That's really interesting. Can you think of any specific cases that you've done, that you've worked on lately that really...
Oh my God, there's so many situations. Every day I have a new story or a new case. I love practicing medicine online. I have a patient who was going through the drive-through and they handed her hot coffee and she had a scalding burn. Well, if she had gone to the ER, she would have had a ridiculous copay and they would have done exactly the same thing that I was able to do for her. So I saw her, I was able to assess her burns, I was able to treat her, and then I still have a physical office, so she was able to come back and see me 2 days later for follow-up care and continuity of care, which is very important as well. And so that's just one easy, simple situation, but we manage high blood pressure, diabetes, chronic conditions. I love weight loss, so I do a lot of health maintenance, nutrition, focusing on that healthy lifestyle. So that's a big part of my practice as well.
And so where do you see the future?
I think the future of telemedicine and the future of healthcare is really, we're going to see less offices, less physical offices, more doctors practicing medicine online, and it's going to be a global healthcare system instead of looking at healthcare in terms of just here in the United States. You'll have Chinese American doctors taking care of people in China. You'll have people taking care of people in the Middle East, and people will really be able to say, I want the best doctor anywhere in the world, not just in my geographic region.
That's a
major of medicine.
It's unbelievable.
Yeah, it is. It is. I get excited about it. I've been doing this for 3 years, but I still wake up and really get excited about all of the potential that's here in this industry because it's still growing. It's still so new. Every day, new doctors are adopting it, trying it. Patients are learning more about it. So it's just an exciting time to be in healthcare.
Wow. And so it's an exciting time to be here, too. How many years have you been coming to this conference?
Oh, my God. This is my 4th year coming to the conference because I actually came the year before I started my practice. So every year, this is one of the best years of ATA, I believe. I love the exhibit hall this year. It's so open. It's really exciting. The energy is phenomenal. And I just look forward to continuing to come back for years to come. The connections is what really makes ATA so special. I come here, I see people in the industry that I've come to know, to work with, and it's just always a great time.
Is there any specific seminars you're looking forward to this year?
Women in telehealth. Oh,
I've heard that.
God.
All day.
Yes, I am really passionate about women in entrepreneurship and really seeing how the numbers are growing and more women are taking leadership positions and really having an opportunity to network with those women and foster those relationships and support one another and encourage one another is really exciting.
Yeah, no, I've heard everyone's looking forward to that. Okay, well, thank you so much for stopping by.
No problem. It was great to talk to you today, and I'm looking forward to it.
Yeah, really interesting. Okay,
Thank you. Awesome.